So recently I was going through my Facebook feed as usual, and I came across this picture. The nurse pretty much felt like she was being vindicated for not vaccinating, and my response to that was this. Me, I was diagnosed with leukemia years ago, and there were many moments in my treatment where I nearly did die to things like the flu. People like me really are at high risk of getting the flu. But I mean, this sentiment, it's been growing over the last few years. And I mean, this picture goes to show that it's even there in educated people. Me, I'm a medical student right now, and I also tutor medical students in these ethics classes. I mean, most of these medical students, the cream of the crop, who do know how these things work, weren't going to be getting a flu vax. Their reasoning wasn't because of the woo and the many, many misinformed theories that the anti-vax movement has on vaccines and their safety and efficacy, but rather these three big things. One, they weren't getting it because they thought it wasn't that effective. Two, they were saying that they'll get sick because of it. And three, that it's too much of an effort for too little reward. Well, this is medical facts, so let's go into those. Number one, vaccines aren't effective. Well, the thing is, they reduce rates of flu by between 40 and 60% most years. That doesn't seem that high, but that's everyone's risk. Only 40 to 50% vaccinate. If you do, your rate of contracting the illness is significantly lower. I'll tell you more about why you may get sick and how that's not the flu vaccine's fault in the next question. But even if you do get the disease, you'll have a much less severe course of it in most cases because you did get that vaccine. So how is everyone improved by this? Well, basically, it's this thing called herd immunity. The more people that vaccinate, the less chances there are of the disease spreading. Now, the number required to hit that magical no disease eradication mark is between 80 and 90%. Right now, we're between 40 and 50, which isn't good. It'd be hard anyway to completely eradicate the flu because it's a tough ask getting everyone to vaccinate every year. But you do keep those around you safe. And the good news is that vaccination rates amongst doctors are around 84%. But that number's from 2011, and I'd say we've probably gone downhill from there, unfortunately. But that's why it's really important for people who are going to be interacting with vulnerable people like me, the elderly, the young. For them, getting vaccinated is super important. Why am I explaining herd immunity? Well, apparently explaining it results in much higher rates of vaccination. So hey, if you're on the fence, I hope this makes you get out and get that. Now, the second reason that most people didn't want to vaccinate was that because they get sick of it. Well, first off, flu vaccines are generally inactivated vaccines, meaning they have no virality. They can't make you sick because of the flu. What you're experiencing is either you getting unfortunate enough to get the flu in that 2-week period it takes for you to develop immunity, or you getting a more systematic reaction, which happens sometimes, but is almost always a low-grade fever, if anything at all. The rate of getting that is about 3 in 10,000 in children. A record number of children died in the US from flu last year. I mean, 3 in 10,000 seems like a huge risk, but if you get the flu, you have a 1 in 120 chance of dying. A 1 in 11 chance of being hospitalized because of it. And this doesn't just kill elderly people and people like me, it kills regular healthy people too. Now, number 3, it's too hard and too much of an effort to go and get that vaccine. Well, giving you a chance of contracting the flu relies between 1 in 10 and 1 in 5, and that the flu will be some of the worst weeks of your life for anyone who's had it or knows anyone who's had it before. It's probably worth that hour to go and get that checkup and get that vaccine. And I mean, you get a free lollipop too. But I mean, if you're in a vulnerable population, in many countries, the flu vaccine is completely free or subsidized. And if you're a healthcare worker, a lot of the time, there'll be flu shot clinics in your hospital. As I said, it's really, really important, especially if you are dealing with sick people, to get that flu shot. Please, for everyone's sake, go out and do it. So what do you do if you do get the flu? Right now, there isn't that much good treatment for it. There is Tamiflu, which is most effective in the first few days of being symptomatic. But otherwise, sitting up is something that does reduce rates and severity of pneumonia. Rest and relaxing, gargling, hot soup, all that good stuff is good. And it's important as well to not go out and spread it to everyone. Me, something I've been working on is creating this smart bed that you can have at home that converts any bed into a hospital bed for less than 1/10 of the price. Smart sensors underneath that will be able to map users' movement and alert nurses, as well as loved ones, of falls, pressure sores, pneumonias. If someone's stopped breathing, the aim is to get this out there in an affordable manner to prevent these common unnecessary complications from taking people's lives. If you want to learn more about that and help us out in our mission, check this out. All of our profits are reinvested into creating more medical devices and towards medical research, which is something that app will allow us to do as well. Got some cool machine learning that's going to be implemented into that too. So yeah, if you'd like to check that out, go here. I'm sort of new to this. And otherwise, follow on. I'm going to be looking at some common alternative therapies and seeing whether there is merit to them, whether whether they're worth pursuing. Because you know what? Some of them are. They can help, but many simply aren't. Now, I know it can seem scary, a lot of the stats and figures that are out there, but a lot of people are making a lot of money by spreading misinformation. Some general pointers: if you are looking through an article and it seems scary, read and actually go and check those sources. It's from a journal article like these. It's more likely to be reliable. That being said, one article, one study on just a few patients is not always going to be a reliable thing that you want to be making life decisions on. But I mean, this is something that everyone in the science community, people who do get flus and shots themselves, are backing. So keep that in mind. My name's Nick Hill. As I said, I'm an ex-cancer patient, current medical student. So yeah, follow on, subscribe, and hopefully the next one will be on cancer. Is cancer really a fungus? Find out next time on Medical Facts.